Sleep apnea is basically a condition in which when you are sleeping, be it night or in the daytime, your body forgets to breathe, and then your brain wakes you up and tells you, hey, you stop breathing, start breathing again. So it is an episode of no oxygen going to the brain, which is making the brain wake up. And that basically is the crux of sleep apnea, commonly known as, oh, I'm snoring at night, my wife is waking me up because I make these weird sounds at night. That is all related to sleep apnea. Sleep apnea can happen in any age group, be it a little child all the way to adulthood, all the way to geriatric age. So there is no age related sleep apnea, but over course of time, the older we grow, our muscles become more and more relaxed, and at that time the sleep apnea becomes higher and higher. Sleep apnea affects our oral health in many ways. Number one, we start grinding our teeth, and that's one of the common effects of adjusting our jaw to sleep better, to breathe better at night. Number two is dryness of the mouth. Maybe sometimes we are opening our mouth to breathe better at night without realizing it. So dry mouth leads to gingivitis or gum inflammation, because gums are not supposed to be dry. They are supposed to be moist with saliva. The third thing is periodontal or gum disease going on because of that. Number four is mouth sores. Same reason, because our mouths become dry, soreness starts developing, bad bacteria start evolving more and more in those spots. So a lot of grinding, gritting, breakage of teeth, breakage of old restorations such as crowns or fillings, that can all be related to sleep apnea. Majority of the times, I would say, unless and until your wife is waking you up at night and telling you, hey, you need to do something about it, the dentist will be able to diagnose sleep apnea. Diagnose not so much, but they will be able to tell you that maybe you are having sleep apnea. The right diagnosis is done when you get a sleep study done, and that is done by a sleep specialist, pulmonologist, sleep specialist person. So the dentist will observe, they will make recommendations. You have to get a sleep study done, and then the dentist can make oral appliances, and that is what we do in our practice. We make a lot of oral sleep appliances that help you with your sleep apnea and make you sleep better at night. There can be many treatment options, my dear, but first and foremost, you need to see a sleep specialist. And depending on the rating that they do on your sleep apnea, if it's mild to moderate, then a dentist can make oral appliance. And oral appliances go in between your teeth, they adjust your jaw in a certain manner, and that way you will not have sleep apnea at night, and you'll be able to sleep better, and your body is able to recuperate better because you're sleeping well and your brain is not waking you up every 10 minutes or every 10 seconds to ask you to breathe. Now, the other treatment modality is sleep PAP machine, which is recommended by physicians, sleep specialist physicians, if you're having severe sleep apnea, and that is a contraption that goes on top of your nose and it's connected to a machine, and it is forcefully throwing in air into your nose so that your body is well oxygenated. Now, for some patients, they are able to tolerate sleep apnea machine well, but for some patients, they are also not able to tolerate the sleep apnea machine, in which oral appliances are then recommended by the dentist. Oral surgery of some sort, in which the muscles on the inside are lasered out and soft tissue is lasered out. If a person is obese, if there's extra tissue in the back of the throat, yes, a surgical procedure such as laser can be done, and that can also take care of some part of sleep apnea. Having said that, that has to be in combination with oral appliances. Oral appliance, there are different types. They're called Snorby, Snorsop, Prosomnus, so on. There are many in the market, but depending on your case per se, we will recommend an oral appliance for you. That is very simple, my dear. If you're observing that yes, you are indeed snoring at night, or gritting or grinding your teeth, or making weird sounds while sleeping, or waking up during the wee hours, which is abnormal, or waking up to drink lots and lots of water, that is another indication. That means that your mouth breathing. Give us a call, 202-223-2070. Pick up the phone, give us a call, ask for an appointment. We'll be happy to take care of you immediately. I hope that answers some of your most commonly asked questions and give you a better understanding on the subject. Having said that, we'll be happy to take care of you. Give us a call back at 202-223-2070. Take care now.